There are many methods of contraception available on the market. Today, we are going to talk about intrauterine devices. We are going to focus on the benefits, disadvantages, and how we can use this knowledge in the nursing process during our nursing career. The intrauterine device is also known as the IUD. An IUD is a small T-shaped device that is made of flexible plastic that is placed inside the uterus. As we can see on this diagram, the IUD is placed inside the uterus. This shape deters sperm from reaching the egg at the fallopian tubes. At the bottom of the shaft of the IUD is string-like structures. These string-like structures are used to check for placement and for removal of the IUD. There are two types of IUDs. There is the Paragard IUD, which has copper coiling. The copper coiling on this IUD is used as a spermicide. The copper IUD can last up to 12 years. The other type of IUD is the hormonal IUD. The hormonal IUD releases small amounts of progestin, which thickens the vaginal mucus, preventing the egg from reaching the sperm. The hormonal IUDs can last up to 5 years. The name for that IUD is the Mirena. There is also the Skyla, which is just a little bit smaller than the Mirena, that lasts up to 3 years. We are now going to talk about the benefits of IUDs.
There are many benefits to an IUD. According to the CDC, an IUD is in the highest category of contraceptive effectiveness. There is less than one pregnancy per 100 women in a year, which is roughly a 1% failure rate. With an IUD, you do not have to remember to take a daily pill or a tri-monthly injection, so there is less likely to have user error. Also, there is no evidence that an IUD interferes with the metabolism of other medications such as antibiotics. Antibiotics interfere with the method of action of some birth controls, which require the use of another method while on antibiotic therapy. This is not needed with an IUD. They are the most cost-effective method of birth control over time. At placement, an IUD can cost anywhere from $500 to $1,000, but after placement, it is only required that you have one visit about 4 weeks after placement to ensure that the IUD is still properly placed. After that, the IUD can be checked at yearly exams. IUDs do not require cooperation of sexual partners. They also can be removed at any time, and normal fertility can be reestablished within one cycle. It is safe to use an IUD while breastfeeding because they do not release any estrogen. Hormonal IUDs can relieve heavy menstrual bleeding and cramping in most women. Also, some women experience no menstrual cycle roughly about 6 months after placement of an IUD. It is easy to use an IUD, and the user must only check the strings for placement, but no other upkeep is required. The Paragard IUD can be used as an emergency contraceptive up to 5 days after unprotected sex. We are now going to discuss the risks and disadvantages of an IUD.
As with any form of medical procedure, there are disadvantages and risks to the placement of an IUD. The first risk is that of an ectopic pregnancy. However, the risk of ectopic pregnancy, which is a pregnancy here in the fallopian tubes, that instance is actually lower with an IUD, according to research by advanced practice nurse Kimberly Firtherford. She said this risk can be lower because of the T-shape keeping the sperm from actually reaching the fallopian tubes. In any case, the risk of an ectopic pregnancy is no higher with an IUD than it is with any other birth control method. With use of an IUD, there is an increased risk of pelvic inflammatory disorder, especially in women with multiple sexual partners. One of the risks of having an IUD placed is expulsion of the device. That is where the device comes through the cervix and is expelled into the vagina. The physician will have to replace the IUD after expulsion. However, this only happens in about 1 in any 20 women. One of the more serious complications of an IUD is embedment of the IUD into the wall of the uterus. This can require surgical intervention to remove the IUD and may complicate future pregnancies. A more serious complication would be that of perforation of the uterus. Perforation of the uterus is where the uterine device goes through the uterine wall. This can cause heavy bleeding, hemorrhage, and could be a reason for a physician to perform an emergency hysterectomy to stop the bleeding. The Mirena device as well, because of the use of hormones, increases risk for breast cancer and ovarian cysts. Any woman considering the use of an IUD should know that there are some contraindications against using an IUD, one of which would be uterine abnormality or distortion. This can make placement of the IUD difficult, if not impossible, and the physician would counsel use of other method. In the case of genital bleeding of unknown etiology, the physician will want to establish the cause of the bleeding before actually inserting the IUD. He may order thyroid function tests or a pelvic ultrasound in order to ensure that there is no malignancy or cause to not place the IUD. Also, the IUD cannot be used in cases where there is known or suspected uterine malignancy, which would be seen on a pelvic ultrasound, and also in known or suspected cervical neoplasia, which is normally caught at routine pap smears. The use of an IUD is contraindicated in pregnancy. However, this isn't the case for the Paragard as long as it's used within 5 days of the unprotected sexual encounter. Any woman with an active case of pelvic inflammatory disease will want to wait until the disease has cleared before speaking with her physician about placement of an IUD. Paragard also has a risk warning for Wilson's disease. However, this is a theoretical risk according to Kimberly Firthafor. The one important thing a woman must keep in mind when using an IUD as birth control is it does not protect against any form of sexually transmitted infection. So a barrier method with multiple partners or new partners is highly encouraged. Now that we've discussed the disadvantages and risks to using an IUD, let's see how we can apply this in our nursing process.
In our nursing careers, we can utilize this information to provide teaching for our patients. We want to make sure our patients are knowledgeable on the uses of the IUD. The IUD must be placed by a physician. This cannot be done by nursing staff. We also want to make sure our patient does placement checks routinely by checking for the strings in the vaginal canal. We also want to report the IUDs on medication list, such as the Mirena, which releases small amounts of hormonal progesterone. We also want to let the client know that there is a need to use barrier methods to protect themselves from sexually transmitted infections. We want our clients to know the benefits and risks of an IUD. We also want our clients to know the complications that should be reported to physicians, such as new onsets of heavy bleeding or irregularities. Thank you for watching our video on intrauterine devices.